Welcome back to the second video in our TMJ series. This is the second video of the series, so make sure to check the first video about the TMJ anatomy before proceeding with this video. In the last video, we explored the anatomy and the structure of the temporomandibular joint. Today, we're taking it a step further by diving into the fascinating functional movements of the TMJ. So let's get started. The movements of the mandible are as fascinating as they are complex, and they can be divided into three key categories. First, vertical movements, the essential opening and closing motions that we use every day. Second, the sagittal movements, where the mandible glides forward and back, what we call protrusion and retrusion. And third, lateral movements, the smooth side-to-side shifts known as laterality. All these motions depend on the TMJ working in perfect harmony to function smoothly and painlessly. In this video, we're diving deep into how the TMJ and its muscles coordinate these movements, revealing the intricate mechanisms behind every action. Stick around for a detailed breakdown that will leave you with a crystal clear understanding of the TMJ's role in the mandibular dynamics, starting with the opening and closing of the mouth, moving to protrusion and retrusion of the mandible, and finally, lateral movements of the mandible. The mandibular dynamics include several fascinating movements, two of which are key: rotation and translation. Let's focus on rotation right now. It is the first step when you open the mouth and the final stage when you're closing it, also known as the hinge movement. So imagine this. The movement occurs around an axis that connects both condyles, which means your teeth can separate and come together without shifting the position of the jaw, as long as the opening stays within 20 millimeters, so 2 centimeters. This motion happens in the lower compartment of the TMJ capsule, right between the condyle and the articular disc. You can see the rotation happening right now. Translation, on the other hand, is the second stage of opening your mouth and the first stage of closing it. And it plays a key role when your joint shifts forward, so in protrusion, or moves sideways in lateral motion, or even a combination of both. So imagine this. While the rotation is all about hinge movement, translation is when both of your condyles work in perfect harmony, moving together in the same direction along the articular eminence, as you can see in this video right here. The jaw can open up to 40 to 50 millimeters during the translation, and it takes place in the upper part of the TMJ capsule. What's interesting is that as the condyle glides along the articular eminence, right over here, they both move anteriorly and inferiorly, helping your mouth to open wider. The axis of this motion is located at the rami, so as the condyle shifts forward, the mandible itself moves posteriorly and inferiorly. This complex movement is what allows your jaw to perform all these essential actions, from talking to eating smoothly and efficiently. Let's talk about mouth opening in an overview right now. Then we break it down even further into step by step. This movement is not just a simple hinge and slide movement. The process involves two distinct stages, stage 1 and stage 2, and the muscles and ligaments play a key role here in controlling it. In stage 1, as you begin to open your mouth, the movement is essentially rotation and occurs up to about 20 millimeters. During this phase, muscles like the mylohyoid that you can see right here, the genohyoid, and the anterior belly of the digastric are all at work, allowing the jaw to move downwards, causing a rotational movement of the condyle under the articular disc in the lower compartment of the capsule. The rotational movement is then stopped by the tension in the extra-articular ligament, like the lateral ligament, and the inferior head of the lateral pterygoid muscle, which forces this movement to shift from a rotational one into a translational one. Let's break this down now step by step, focusing on the articular component of this phase. In the initial phase of the mouth opening, a noticeable change occurs within the TMJ. The condylar head engages in pure rotational movement, which takes place, as I said before, within the lower compartment, so right over here. This unique rotation continues up to around 20 millimeters of mouth opening. But here's the catch. Once you open beyond 20 millimeter mark, the movement shifts gear. the rotational phase ends and the jaw transitions into the second stage of transitional phase, where different mechanisms takes over completely. It is like TMJ has its own choreography, seamlessly moving between phases to allow your mouth to open even further. Moving now to the muscular component in the first stage of mouth opening. Specific muscles work in harmony to lower the jaw, ensuring smooth rotational movement. Some of the depressors muscles, namely the anterior belly of the digastric muscle, the mylohyoid muscle, and the geniohyoid muscle, play important roles, contracting to pull the mandible downward, enabling the initial stage of mouth opening. These muscles facilitate precise and controlled mandibular movement, preparing the jaw for the transition into the next phase. As the jaw continues to open beyond 20 millimeters, this transitional movement takes over, starting the second stage of mouth opening, and the jaw can open up to 40 to 50 millimeters. This phase is driven by the contraction of the lower head of the lateral pterygoid muscle, as I said before, as well as the tension of the lateral ligament. The retrodiscal lamina also plays an important role by resisting the movement of the disc, but the condyle continues sliding forward beneath the disc until it reaches the anterior edge. So there's a perfect balance of rotation and translational movement that allows your mouth to open smoothly and efficiently. With that being said, let's dive now into mouth closure, a movement that's just as dynamic and fascinating as mouth opening. During this phase, the disc condylar complex moves superiorly and posteriorly, sliding back into its resting position within the glenoid fossa. This repositioning is carefully coordinated action that ensures smooth and precise jaw closure. Key to this process are the protective mechanisms within the TMJ, the upper retrodiscal lamina, an elastic structure that has a recoil effect as I mentioned in the first video, as well as the Sinker's bed, or the Sinker's pillow, a hydraulic blood damper. Together, they safeguard the articular surfaces of the TMJ during the backward movement of the disc condylar complex, maintaining jaw health and function. Let's break down the mechanisms of mouth closure now, which also occurs in two distinct stages. Think of it as a reversed opening. Let's talk about the first stage. This initial stage involves a reversal of the translational movement, guided by the isotonic contraction of the anterior temporal head, working together with the elevator muscles like the masseter and the medial pterygoid. These muscles work in harmony to bring the mandible back from an open position, beginning its journey up towards occlusion. In the first stage, the condylar disc complex moves backwards and upwards along the articular eminence, reducing the mouth opening from 40 to 50 millimeters down to about 20 millimeters. At this point, the second stage of movement begins. Moving now to the second stage. In this stage, the movement transitions into a rotational motion exactly similar to that in mouth opening, only reversed during this stage. This motion is driven by the retropulsor muscles, including the posterior fibers of the temporal bone, the deep fiber of the masseter, and the posterior belly of the digastric muscle. This action gradually guides the mandible into closed position. The process is stopped naturally by the occlusion of the dental arches, a reflex that ensures proper alignment. However, if closure is forced beyond the natural limits, it will be an isometric contractions of muscles such as the temporal, masseter, and the medial pterygoid, providing increased resistance and stability. As the closure movement comes to its end phase, the tensor apparatus that we discussed in the first video steps in to ensure the condylar head is properly seated within the glenoid fossa. This apparatus, consisting of the posterior temporal fibers, the deep masseter fibers, and the superior head of the lateral pterygoid muscle, also serves to protect the articular surfaces from excessive pressure. At this stage, the inferior head of the lateral pterygoid relaxes, signaling the end of the closure process. Understanding mouth opening and closure facilitates the comprehension of other mandibular dynamic movements. Therefore, we're now diving into the fascinating movement of mandibular protrusion and retrusion. These movements might seem simple, but they're essential for everyday actions like chewing, speaking, and maintaining a balanced bite. When the mandible moves forward in protrusion, your lower teeth slide ahead of the upper teeth, a critical function in tasks like biting into food. In retrusion, the mandible shifts backward, realigning your jaw to its resting position. Both movements rely on a harmonious interplay of muscles and ligaments to keep things smooth and efficient. Stay tuned as we break down how these actions work and their role in the intricate mechanics of the TMJ. Let's talk about mandibular protrusion, a critical movement that plays a significant role in how we chew and tear food. Protrusion refers to the forward movement of the mandible from its resting position. During this motion, the condyle and the articular disc of the temporomandibular joint slide forward along the articular eminence, enabling the lower teeth to shift anteriorly relative to the upper teeth. This action is essential for tasks like biting into food. We will dive deeper into the biomechanics and the muscular involvements that makes this movement possible. Starting with the articular mechanisms of protrusion. When your mandible moves forward in protrusion, the condylar disc complex glide beneath the temporal plane in coordinated precise motion. Unlike a full opening, this movement stops short, limited by the upper retrolamina and the capsular ligaments as well as muscle tension. It is primarily a translational motion, meaning the condyle slides almost completely along the temporal articular eminence with minimal rotation involved. The condylar slope, or the articular eminence, plays a vital role here. This slope defined as the angle created by the condylar path on the sagittal plane relative to a horizontal reference plane. It's unique to each individual. Its steepness or flatness is influenced by genetic and anatomical structures, which ultimately determine the nature of the masticatory movement. In other words, a steeper condylar slope makes the movement sharper and more distinct, whereas a flat condylar slope leads to a smoother, gliding rubbing motion. Next, we're discussing the muscular mechanisms of protrusion. This motion relies on the perfectly coordinated action of three key muscles. The lower head of the lateral pterygoid muscle, which is the primary force behind the pulling of the jaw forward or in protrusion. The superficial head of the masseter, which supports the movement with additional force, and the medial pterygoid muscle, working alongside the others to ensure the mandible stays steady and symmetrical during its glide forward. Lastly, the dental mechanisms of protrusion. When the jaw moves forward, the incisal edges of the lower mandibular incisors slide along the palatal surface of the upper maxillary incisors, eventually reaching to what's known as edge-to-edge position, a perfect alignment where the upper and the lower incisors meet at their tips, where lastly the mandibular incisors overpass the maxillary incisors, manifesting the protrusion movement. Take a closer look at the mandibular retrusion, a crucial movement in the temporomandibular joint. Mandibular retrusion refers to the backward movement of the mandible from its forward position. This action is literally the opposite of protrusion. Let's break down the articular mechanism of retrusion now, the backward movement of the jaw. Retrusion begins when the condyle moves posteriorly, so backwards. As the condyle moves back, it slides along the articular eminence, and the articular disc follows it. However, the movement doesn't go on endlessly. It's limited and quickly stopped by the retrodiscal tissues and the tensor apparatus of the disc. These structures essentially act as brakes, preventing the condyle from moving too far back into the joint, ensuring the jaw doesn't overextend. The muscular mechanisms of retrusion involve several muscles work together to make this happen. The primary muscles responsible are the posterior fibers of the temporalis and the posterior belly of the digastric muscle, which contract simultaneously to pull the mandible back. The masseter can also play a supporting role, especially the deeper fibers, although it's more involved in other movements like jaw elevation and protrusion. Now let's talk about the dental mechanisms during retrusion. Unlike protrusion, where the lower incisors move forward to meet the upper incisors in an edge-to-edge position, and even further, retrusion works in the opposite direction. During retrusion, the mandibular incisors start to move backwards towards the maxillary incisors in an edge-to-edge position, and then further away from the maxillary incisors as the jaw moves backward. This backward movement continues until the condyles return to their posterior position within the mandibular fossa. So essentially, it is the opposite of the protrusive movement, where the jaw moves backward and the incisors separate. Understanding the complexity of protrusion and retrusion gives us a step forward to understand an even further complex movement called deduction. Deduction is the lateral movement of the mandible, which deviates from purely lateral actions. Because true pure lateral movements are nearly impossible because of the temporomandibular joint acts as a reciprocal obstacles. Instead, deduction involves the mandible alternatively rotating around each condyle. Before starting this, let's clarify some terminology. First, we have lateral retrusion. This occurs when the mandible moves away from the median plane, while mediotrusion involves the mandible moving towards the medial plane. Deduction is inherently asymmetric, with a horizontal component. It features two phases. The excrusion phase, so in other words, the go phase, the movement away from the starting position, and an incrusion phase, or come phase, the return towards the initial position. The term lateral mandibular movement simplifies this concept, as deduction involves both sides of the jaw working together, making it more complex than just side-to-side motion. With that being said, let's focus on the articular mechanisms of deduction. On the working side, also known as the rotating side, during excrusion phase, a lateral retrusion moves the interincisal point from its normal position in maximum intercuspation to the furthest point of deduction. The hemimandible on the same side, so on the blue side, performs a working lateral trusion, while the contralateral hemimandible, the one in red, undergoes a non-working medial trusion. During the return motion, in the incrusion phase, the homolateral hemimandible engages in a working medial trusion, while the contralateral hemimandible executes a non-working lateral trusion. I understand this is a bit complex, but try to repeat this part as much as possible until you understand what I'm talking about. The pivoting condyle on the working side, so in this diagram it's on the working side right here, rotates around its medial pole, with the axis of rotation passing through this point. This rotation is facilitated by a slight lateral condylar movement. During this process, the pivoting condyle also experiences a slight upward, backward, and lateral movement. On the non-working side, the condyle is referred to as the orbiting or balancing condyle. It follows a broader path, typically greater than 10 millimeters, and during the excrusion phase, you can see it exhibits a downward, forward, and a medial movement. As complex as the articular mechanism of the deduction is, understanding it is quite crucial in order to move forward. Moving now to the muscular mechanisms of deduction. On the balancing side, or the orbiting side, or the non-working sides, it has many different synonyms. The inferior head of the lateral pterygoid muscle, in coordination with the medial pterygoid muscle, as well as the superficial masseter muscles, they contract together during this mandibular movement. So in this case, the mandible is going to have a laterality movement to the left, meaning this side will be the non-working side and this side will be the working side. With that being said, on the working side, the posterior fibers of the digastric muscle, the posterior fibers of the temporalis, and the deep fiber of the masseter muscle engage to produce the necessary forces in order to perform this lateral movement. So together, the posterior temporalis muscle on the working side and the lateral pterygoid on the non-working side generate a force couple around the pivoting condyle or the rotating working side. This coordinated muscle action facilitates the movement, but it is rapidly limited by the tension in the ligaments and muscles, preventing excessive displacement. Now moving to the dental level. The canines primarily make contact during the lateral extrusion of the mandible. This contact continues until maximum laterality is reached, at which point the non-working side teeth undergo disocclusion, meaning they are no longer in contact during this movement. So, functional movements of the mandible involves the coordination of various basic movements that occur simultaneously across multiple planes. These movements are essential for daily functions such as mastication, deglutition, and phonation. The TMJ, along with the mobilizing muscles, play an important role in these actions. Together, they work to enable efficient and smooth jaw movements necessary for chewing, swallowing, speaking, and facial expressions. So thank you all for watching and taking the time to learn about different dynamic mandibular movements. I hope this video provided valuable insights and helped clarify the complexities of these fascinating mechanisms. If you have any questions or thoughts, feel free to share them in the comments below. And stay tuned for more informative content about the TMJ. In the next upcoming video, we will dive deeper into the pathology of the articular disc, which will hinder these physiological dynamic movements that we discussed today. And with that being said, see you in the next one.